Pregnant women develop more serious illness when they contract COVID than non-pregnant women who are a similar age, similar health. They develop more hospitalizations. They have to be in the ICU more often. They need the use of a ventilator more often. They even die more often. And it's 3 times the risk of hospitalization compared to a non-pregnant individual. If a pregnant woman develops immunity to COVID, especially with the vaccine, and she has a high level of antibodies, she passes those on to the infant. And in the first 6 months of life, we have really good experience and data that a pregnant woman who's been vaccinated with COVID is much less likely to have her infant get COVID or get hospitalized from COVID. So not only does it protect her, it protects her pregnancy, it protects the infant in the first 6 months of age. Currently, there isn't a COVID vaccine recommended for infants 0 to 6 months of age. And so really the only way infants 0 to 6 months of age can get protection is through a maternal source. Infants 0 to 6 months of age actually are pretty high risk when they develop COVID. They have the same hospitalization rate as adults over 65. And we're recommended to give adults over 65 those vaccines. So I think it's ironic that here we have this really vulnerable group of humans that we know about with increased hospitalization, increased challenges when they contract COVID. We have great data that getting the vaccine in pregnancy helps prevent those 0 to 6 months old people from getting COVID. And somehow that has been lost in this recommendation. So I worry a lot about the protection of infants. I also am worried about access in a couple of ways. One is equity. If insurance chooses not to cover this vaccine and people only have the option of paying out of pocket, we know that a lot of people aren't going to be able to afford it. And we know that a very high percentage of pregnancies in this country are covered by Medicare. And so if Medicare doesn't cover it, what will that mean? It's a big challenge.